We're glad you can join us again. Now, the United Kingdom has acted on the WHO's directive by placing Nigeria on the red list of countries that should not be actively targeted for recruitment by health and social care employers. Now, this is coming 1 month after the World Health Organization listed about 55 countries, including Nigeria, facing the most pressing health workforce challenges related to universal health coverage. Now, the United Kingdom government said Nigeria and other countries on the red list should not be actively targeted for recruitment by health and social care employers unless there was a government-to-government agreement. According to a report by the Nigerian Medical Association, Nigeria has experienced a significant brain drain in the health sector over the years, with a large number of trained medical professionals leaving the country to seek better opportunities abroad. And a report released in January estimates that about 2,000 or over 2,000 doctors emigrate from Nigeria every year, with the UK, the United States and Canada being the top destinations. This brain drain has contributed to the shortage of healthcare workers in Nigeria, leading to a high doctor-patient ratio, inadequate healthcare facilities, and a high burden of disease. So we ask critical questions now. What are economic implications of this brain drain in the health care sector? And what does the UK's decision to place Nigeria on red list mean at this time? Well, let's get talking now. Dr. Benjamin Olowojebutu is the chairman, Nigerian Medical Association, NMA Lagos, joins us now for more insight. Thank you for joining us, Doctor. We appreciate you for coming.
Good morning to you. How are you today?
Yeah, good morning. I'm fine. I know the reason why we brought you, it's because of this report as read out in our intro and what the association think about it. But let me start first, before we get into that conversation. Give us your assessment of the healthcare sector in the last 7 to 8 years, specifically under this administration. How has it fared with some of the challenges, and conversation on a table to address some issues?
Thank you for having me today. I think we've moved forward a little bit, but we have also moved backwards more, because the generality of the healthcare space has not been effectively affected, by the system. You look at the doctor-patient ratio. You look at the rural-urban migration. How many have we focused well on primary healthcare system, which is the bedrock of healthcare in Nigeria? How many communities, rural communities, have proper healthcare system? People have issues in rural communities. They have to come out to the urban to get it sorted. So, is there a general assessment of looking at Nigeria as a population and creating healthcare intervention as regards the population? I don't think we've done that. You look at our activities on disaster. We had Ebola years ago. We had COVID this time again. How did we assess it? Did we learn very well from Ebola? And were we ready during COVID? What have we learned from COVID again going forward in the next few years again if we have another disaster? So for me, the system have not owned the process. If a government loves the healthcare system, they will use the healthcare system. You don't have people leaving the country because they have particular healthcare challenges, and they say they're investing the money they're supposed to be investing in our healthcare system to another country, medical tourism, because that has not reduced, that it has increased. If there's a small problem now, all the politicians leave the country and go abroad. They are not patriotic enough to use the healthcare system that they're building. So, how well have we done? I don't think we've done too well. The budget for healthcare that's going to be 15% by that meeting in Berlin is still 7.5, it's 6.7%. And how effective is this budget? Who is accountable? Who is monitoring this budget? What are the outlook? So because I think we should work on evaluation. So after a year, this is the budget we spend on healthcare. What have we achieved in this year on healthcare or on healthcare intervention? So for me, we still have a long way to go. We must fix the country. We must fix the economy, because it's not only just healthcare, education, right, security, the economic. You see what happened last few times. The economy was very, very bad. People cannot afford to even eat. And when you cannot eat properly, you are going to be sick. So those are my reasons. I think we need a lot of work to be done in the healthcare space, and the government must find a place to make a conducive environment of working in this country.
Let's talk about dwell on the budget issue a bit more. What's the requirement in terms of percentage of the budget that must be allocated, for the healthcare sector
At least 15,
globally?
At least 15%.
But if you put that side by side with how much the Nigerian government has budgeted to the health sector in Nigeria, so how would you rate it in terms of performance?
So this is what I like to say to people, so we understand perspective. We can't be comparing Nigeria to the US, to the UK or developed country because of their investment, the years of investment in healthcare, the years of investment in the economy. And you think you can copy and paste their things they do there. You know, what happens to our leaders? They go to and say, this thing is fantastic. They copy it and paste it but the culture of this country, the peculiarity, demographic of this country, power, economy, buying power, workforce, attitude, you can't compare that. So government has not done well in budgeting rightly for healthcare in Nigeria, and we're not accountable to even to the budget. The small budget we have for healthcare, how much are we accountable to it? When we have, sometimes we have the round square pegs. So we're not accountable, to what makes healthcare program very, very well in the country. Let me give you a scenario. So somebody has headache, has malaria, or has food poisoning, wants to deliver, leaves the house, let's say in Yaba, and goes to General Hospital in Ikeja, because they don't know that the primary healthcare system in that area is working, or it's available. It's not popular. So government needs to educate people. Back in this, we had National Orientation Agency. Where are they now?
I think they're still
always talking about things. When there's an outbreak, you said talk about cholera. Back in the days, you said talk about cholera. Take this water. Talking about hypertension, talking about diabetes. But now nobody does anything. So the awareness of healthcare institution, healthcare intervention is not there in the country. So people now, because leaders don't believe in the system, people ourselves do not believe in the system. How many local government chairmen go to their PhD to take healthcare? I tell people it's very simple. Somewhat dichotomy. States, federal, local government. Everybody has autonomy. Now, but every state has an idea of the population, of their health, of the population, and they know how they want to run their healthcare. There must be synergy between the local government and the state government as regards healthcare, most especially primary healthcare system in this country. Very, very important.
We get to looking at some of the challenges. How do we solve it? Policies around healthcare sector and all of that in a moment. But let's look at, why do you think healthcare workers? Because if you look at the doctor-patient ratio, it's quite low. So why do you think health workers are living in drought? Because recently we saw the UK placing Nigeria on the red list of countries that should not be targeted for active recruitment. So why are they leaving?
Many things. One is welfare, 2 is salary package, 3 is economic issue, kidnapping, security. How many doctors, how many healthcare workers have their children go to very good schools that they can afford? How many of them have good cars? I tell you a very, very simple thing. We have Bank of Industry in Nigeria that supports all the manufacturing industries. We have Bank of Agriculture that supports all the farm. Why don't we have Bank of Health that supports healthcare institution, healthcare practitioner? Because we have not paid attention to them. People are living because of the environment, the conducive environment, the infrastructure.
As of January, we have about over 2,000.
Yes.
So what's the number now? Since you're here now,
and
give us a clear figure of how many of them.
So they said last year they had 13,900 doctors 13,900 healthcare workers that came into the UK. 13,900. That means nurses, lab, doctors. So look at it in your mind. So how many doctors have left this country, the shores, on a regular basis, and it's every day they're leaving the country. You cannot stop them from leaving if you don't fix Nigeria. Let me give you somebody writes primary exams to get into residency training. I was using the exams for 4 years, no space for him to even go and do the training. And he gets an opportunity to come and do training abroad. He will leave. The environment, the work ethics is not conducive. Even the tools to do the work are not available. The things we use here now are 10 years, something like they're 5, 7, 10 years ago. I think that I've been using in America or in the UK. So we cannot compare the working condition with working condition of the rigorous training, but the ability to use the training you've gotten to work properly is not there. So there's no conducive working environment. Number 2, you see doctors going to call in the night, and somebody meets them on the road, kidnaps them, and kills them.
That's a sort of insecurity.
Insecurity. A doctor in Delta State, Dr. Oyi, we've never heard about it till today. People went hoodlums went into his hospital and killed them right there in cold blood. In cold blood. We reported to the police. Prior to Commissioner of Police in Delta State, we reported to the IG of Police. Today, there's still nobody found that is guilty of killing this young doctor. So, how do you think other doctors will feel about staying back where they're not protected, where they work so hard, they're not loved? Somebody can wake up in the morning and kill them. Patients' relatives can slap them and say, because my patient died, I must kill the doctor. You know, those things makes the environment very, very unconducive for doctors to stay.
We'll talk about the market and what in terms of implications of these people living. But like you talked about the working condition,
yes.
What sort of working condition would you want to have in place? And in terms of security, some people, of course, will argue that it's a structural issue.
And it's only doctors. Everybody.
Every other person. I mean, so it's not even about doctors alone now. So, but first, let's start from the working condition. What kind of policy, what kind of working condition would you like to see in place? And again, Nigerians will also like to know that in the past, we've seen, enemy ask or request for one thing or the other. And government has been able to meet up with some of those requests. So maybe you can confirm to us here now that you're here.
But the government always try to meet us at the middle after a couple of years. Let me give you a scenario. We lost a lot of doctors during COVID in 2020. A lot of doctors, a lot of nurses, a lot of healthcare workers died of COVID. Helping tame this nation. Dr. Ladivo died helping us salvage Ebola. Do you know she didn't get a national award until very recently, after many years. So the honor, the honor given to those that deserve it are not given to them. What do we need to do? Simple stuff I say. We must invest in primary health care. Is very, very, very important, because the waiting time we see in general hospitals, in tertiary institutions, is because most times the primary health care institutions are not popular enough and the patients are not going there, they're not using it, and the government is not investing and equipping it enough. Thank God for Lagos, but other states, you barely see a primary health care center in those local areas. And I've said it before, there must be a reward system for doctors, healthcare workers that are working in those places. If you decide to say, okay, I want to work in this rural community, I'm patriotic, I'm compassionate, I'm empathetic, I want to serve those people, there must be a conscious reward system for making me stay in rural community. Because I'm not seeing life, I'm not in urban area. So you must encourage people to stay there. I heard there's a particular local government in Nasarawa that had only one doctor for the whole local government.
You know, it takes a whole lot to invest, I mean, for investment.
Yes.
How much do you think it would take for, you know, for such an investment in such a rural area? And do you think it should be the sole responsibility of the government alone to invest in such a place?
So it's simple. It's about collaboration. Local government, state government, federal government, private sector. But people must see what we have done as government to be able to plug in. So, for example, if you say we want to invest, we want doctors. You remember we had this scheme years ago, midwife scheme,
right?
Where midwives that have retired, they're still very active. They're taking the rural community record and taking communities outside their comfort zone, rural communities, to take deliveries of women, do antenatal care, and they pay them some stipend. What happened to that scheme today? Boko Haram came, bandits came, kidnapping came. So there was no safety. So you want to treat somebody and you're not safe. So people went back to their homes. So these things will work if we have general environmental conditions that are sorted, security sorted, economy sorted, and there's a feeling of responsibility of government to own the process. If, for example, local government chairman sits down and says, I will go to this PHC every Monday and Tuesday to check my blood pressure, and if I'm sick, I'll see the doctor there. And he announces it to even to the local government workers. What happens? People will begin to use and they'll know that that place is reliable.
Right.
Not that when the local government chairman is sick, what happens to him? He takes the next flight and it's out of the country with taxpayers' money.
Let's talk about quickly how much, I mean, the country is losing with these mass immigration of health workers in Nigeria. You talk about over 13,000,
yes,
you know, as at last year. In January, we saw a report from your association about over 2,000 doctors have also, you know, migrated as well. So how much is the country losing? Then give us a picture of how, you know, the sector is developed, opening up for markets, for more investment to come in. So how does it function in a developed society?
It's very simple. You have one neurosurgeon you have 3 neurosurgeons in the unit. 3. Let's say you have 3 that can do brain surgeries. 3 of them probably make you an IGR of about maybe 30 million a month, possibly, because you have 3 people doing the work. But when you lose 2 of them, what happens? You lose that IGR because 2 of them will now they've gone to another country. You lost that money because that one person that's remaining cannot do the work of 3 people. There's burnout. There's the issue with mistakes. It's tired. You'll get a leave. So that alone has reduced your income, and it has also reduced your social impact because you have patients having long term. You know, I have surgery. So you come in 6 months now because why? You've lost the impact because healthcare is an essential services.
That's right.
So you cannot qualify by money alone. It's the impact on the global impact and the economic impact. If you lose your workforce to death or to issues, what happens? The economy goes down because the GDP will reduce. The working class will reduce. What happens when the working class reduces? There's no money to make in the economy. So the point is that healthcare is a bedrock of a functional economy because health is what is wealth. When people are healthy, they are wealthy. So you can only work better when there's a functional healthcare system. Why do people build? Why do you have NHS in America, in the UK? Why do you have why do you have the working conditions well in the US? Why do they invest so much? Because when you are healthy, you're mentally stable to work better. You are emotionally stable to work better. You are energetic. You are not thinking about an ailment because you know that ailment is already is sorted because healthcare system is working.
That's right.
How many times can you call an emergency number in Nigeria if you have any issue at home and get somebody to help you? No. Thank God for Lagos. But outside Lagos, what happens? You can't call any number and say, you have an emergency, come and pick me at home. I have food poisoning, or I have a stroke, or accident. I had an accident. So those things need to work properly in this country. Okay. Then we can move forward from there.
Okay, 2 things before you go, before I allow you to go. 1, how is your association working with the government, and other stakeholders in the state, of course, to address some of the issue of brain drain in Nigeria in relation to health sector? Secondly, how are you also working together with the government to bring out a policy lets your your needs be explained in simple terms?
Yes.
And sometimes the accusation that you get your associations you're too ambitious or too demanding in some of your requests to the government as well. So how do we address this?
So
okay, go ahead.
We had this this bill that was mentioned by Honorable Gani Johnson in the House of Rep about 5 years before people start working after medical school. I think I think that's very, very unfair. I think the rep did not ask the right questions, didn't engage NMA or healthcare space to know how these things work, because banning doctors from traveling is not the answer to brain drain issues. The idea is that if you fix the country, people will stay. Have you compared the salary that they earn over there and salary that we earn in this place?
How much is an average salary of a Nigerian doctor?
Okay, so I'll compare that to an average salary of a rep. A rep takes 13 million naira a month, aside allowances.
Right.
No doctor takes 13 million naira a month, not even a year. Yes, no doctor, even to a professor, does not get 13 million naira a year.
How much will a doctor earn, or do you think a doctor can earn to have him stay in the country?
A doctor should earn what he or colleagues are earning averagely outside the country. At least something to make him feel good. So it's not about salary alone.
All right.
So you say a doctor needs a car loan. Give him 1 digit of car over 5 years. A doctor needs house loan, 1 digit interest. You'll keep him here because he's comfortable. Working condition, the tools he needs to work is available. Let his welfare let him be happy working. No molestation, no security issues, no police harassment, no multiple taxes. He's able to say, okay, I want to open a private hospital. I'm able to run it.
Right.
Those are the things that are important. It's not just the salary. Salary is important, but the environmental factor that makes it sweet for you. In the UK, as you get into the UK, they give you a car loan, they give you a house loan. So you're not even thinking about where to stay anymore. Okay. The point is that the country must create an environment to keep their own and own the process. If the government says every politician in Nigeria should, in the first 3-4 years of our stay, we must use the healthcare system in Nigeria, they will make it work. Because if it's not working and they're using it, they will fix it. It's because they don't even know what they don't know what is happening. They're just hearing stories. They don't know clearly what we are going through, practicing in this very, very erroneous, very strenuous environment. Okay. The work is a lot, sir.
Okay. So one final, if you can do that in 30 seconds before I allow you to go. Outlook for the health sector in terms of budget. The new government is coming in, so I'm sure that you're already having a plan on ground, or perhaps you have an agenda that you want the new administration to drive. So what would that be, and how do you?
Number one, increase the budget for healthcare. Number 3, engage NMA healthcare. You must engage healthcare professionals before doing anything in healthcare. Don't just come and impose things. Let there be an engagement. Let there be, so that we can join together and think about it and provide solutions that affects the common man in Nigeria. Most times, what we have done in the last few years is to do things that affect the elite, not affect the common people. Number 3, let us invest more in primary healthcare, so those in rural communities can get healthcare, and that will reduce urbanization of people coming from rural communities. Well,
I think a good place to leave it. Lagos NMA Chairman, Dr. Benjamin Olowojebutu, thank you for coming on Business Breakfast. We really appreciate you for coming.
Thank you for having me. God bless you.
Yeah. You're also watching Business Breakfast, coming to you live from our studios here. We just wrap up talking to NMA Lagos Chairman earlier, Dr. Benjamin Olowojebutu. But coming up on the program after this timeout, global consulting firm KPMG has projected that Nigeria's unemployment rate will rise further to 40.6% in 2023. Well, that's our next talking point when we return from this short break. Please stay with us.